you are on time, Dr. Hess. Good morning. How are you?
Good morning.
The car up there just doesn't know the stop signs. Literally, Bluetooth with every stop sign. No, I usually drive like that.
There's
but
a
I
lot
love
of
it
bad
though.
drivers in this building, so.
Was that when you were there in Lebanon before Mexico?
Yeah.
And they don't
yeah.
Yeah.
I would try my children. Don't drive my room is
Okay. Yeah, so we should be able to get through the letter. Huh? Okay. Good help.
Yeah. Yeah. Yeah.
I will.
Oh, okay.
Yeah. We're ready? Okay.
Yeah.
All right. Now we start with the pledge of allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right. The meeting is called to order. Dr. Vavilala will give us the opening remarks.
Good morning, everyone. I'm Dr. Vavilala, Lake County Health Officer, and I would like to welcome all of you. Thank you for coming. I would also extend a special welcome to our newest board members, Mr. Dean Button, as well as Ms. Dorian Patel. And if you could just introduce yourself, we would appreciate that.
My name is Dorian Patel. I'm very happy to be on the Lake County Board of Health. I think there's a lot of good things this board can do, this department can do for Lake County. I'm in healthcare. I've been in healthcare my entire career. Currently, I'm an ultrasound tech at Powers Health. So I've always been interested in healthcare in the community.
Welcome aboard.
Could you guys please talk louder? We can hardly hear what you're saying.
Ah.
Give my. Thank you.
Hi, good morning. My name is Dean Button. I'm the city engineer for Hammond, Indiana. I've been in that position for about 10 years. My license as a professional engineer rises to the level of being able to serve on this board. I'm happy to do so. And I too am looking forward to helping out whatever I can do to assist the board in making health better in Lake County.
Welcome aboard.
Thank you very much.
I would like to take a couple of minutes to share the wonderful things that we have achieved at the Lake County Health Board with the help of all of our departments as well as all of our staff over the past couple of years. As majority of you know that we have been working with the additional funding of the Health First Indiana. over the past couple of years, which we have been investing and working very hard with our partners as well as within our department. And our partners have been doing an amazing job in working towards providing even more as well as expanding the core public services. And we have been measuring the key performance indicators on a monthly basis as to how we are achieving it and what we can do better to support you. We have also been utilizing the Health First Indiana. We have utilized in purchasing a outreach vehicle, which we have been taking to multiple areas of the community. The vehicle has been extremely helpful in terms of reaching to the communities and the members of the community who are unable to come to the health department. And going forward, we would like to put it to even more of a use. We have done also a very good job, if I may say so, with our staff in terms of our staff has really stepped up, and we have expanded the scope of work almost of every department and every member of the staff. So most of our staff are performing way beyond what they have signed up at the health department. They are helping the other departments. They have been cross-trained to support each other, not only during the emergencies, but even on a day-to-day basis. And that's what we have done. That's been our expectation, and they have really done an amazing job. And one of the other major things that we have done is we have expanded, we have gone to the council, and we have updated our fee ordinance, and then across the board with our food permits, as well as with our all kinds of permits. And then we have been accepting more insurance, and we have been billing more insurance of or whoever can pay, improving the revenue that we are able to get into the health department. And that's something that we probably are hoping to continue to expand as time goes by. That way we can put that money to better use in continuing to serve the community. The Health First Indiana program is coming for re-voting at the end of this year. And we are all working and hoping that the legislators will take into account the wonderful jobs, not only the Lake County Health Department, but all the departments across the entire state of Indiana have been doing. And again, I would like to reiterate the importance of public health. Public health is not always fast. It is not immediate. But as I was sharing with the board members, it's like raising a child. You invest into the child, and at times it takes decades to see the fruit of your labor, but ultimately it will happen, right? You do your best. What we all need to understand is, without better public health, we will not have good real estate. We would not have good real estate. We would not have good economy, and without good economy, we are not going to have younger families moving into the county, not just here, but everywhere. So better health always equals better economy and less spending by our hospitals. So let's all work together and continue to do the great job we have been achieving.
Thank you. The next item on the agenda is the staff presentation.
We have invited our head of the departments from all of our departments to actually come and share everything that we have achieved and what our vision is going forward for all of our departments. So this is the first of its kind. So let's give a round of applause to all of our head of the department.
Okay, so I'm going to go ahead and take over. Can you all hear me okay, or do you need me to hold the microphone? Can you hear me okay? All right, so I'm just going to talk a little bit about some of our overall department wins that we've been experiencing. First on the list is the department has added 6 new services to our department in the last little over year and a half. And that is with STI testing, childhood lead and case management, where we are going into the homes and providing in-home assessments, fatality review teams where we are reviewing the causes of fatality so we can hopefully prevent them in the future. Student health, where we have our school liaisons and our health educators going out into the schools and working directly with the schools and the students. TB control and case management to add latent and active TB. And of course, community outreach, which Dr. Vavilala mentioned with our mobile health clinic. I would just like to share, in my previous role, I worked with local health departments across the state of Indiana and to help them add new programs. And they would maybe add 1 or 2 programs within a year's time. The fact that the staff, the doctor, the board had such vision and stick with itness to add 6 new services in a little over a year is truly remarkable. And really everybody should be commended for that hard work, because it is truly unheard of. Also happy to report that we received 5 grants in the last year from Overdose Lifeline, from Substance Use Prevention, Lake County Opioid Settlement, where we will be putting into place a youth prevention with the CDC Engage program directly into the schools for substance use prevention, working with those students and family. The Autism Elopement Grant from the Indiana Department of Health, where we will be working with families to prevent their youth from eloping from the home, providing safety measures. The STI Prevention from the National Coalition of STD Directors, and a preeclampsia prevention grant providing 125 blood pressure monitors to pregnant moms in need. Also, we have been working to expand our internship program by bringing in interns to educate them and hopefully create public health workers for the future. We have added 6 new interns over the course of the last year with all kinds of areas such as future doctors, nurses, public health educators, data analysts, and environmental health specialists. I'm proud to say that we were chosen as the National Environmental Health Association's one of their health departments to put an environmental health specialist into our county and into our health department, and they are fully funding that. They are paying for relocation fees and for their housing while they are here working with us this summer. And then launching our 4th round of Path to Wellness, which is our weekly walking program that pairs educators and health education with stretching and a scenic walk. Okay, so I would like to say that's enough of having to listen to me, but unfortunately our food director had a conflict and was able to be here, so I'm going to be speaking her talking points to share what our foods division has done over the last year. So I apologize. You don't get Sarah Anderson. So one really big accomplishment is that our team has completed over 5,000 restaurant and food establishment inspections in the last year, which is a huge number, which is terrific. We have digitized our food inspection files. We have shifted inspection focus to concentrate on risk rather than routine, to really make sure that we're identifying what risks are out there and preventing them. And that is one of the state KPIs, or key performance indicators. We've created and implemented SOPs, or standard operating procedures, for inspection and enforcement, streamlined the retail food permitting structure and revised permit applications. Of course, as Dr. talked about, adjusting our fees, which is comparable to surrounding counties. We've reorganized our territories, which allows us to reduce travel, but also have fresh set of eyes and new perspective when we're in those establishments. And we've been working with IDOH and AFDO, which is the Association for Food and Drug Officials, because not only did we do all of those inspections, but we launched a new food code in the last year. And so our staff has been working really hard to get trained on that. Their goals as they look forward into 2026 is training with iPads and becoming more digitized, both in the office and in the field. They're going to be holding virtual and in-person inspector trainings, and standardizing their processes for shadow inspections of new inspectors and shadowing each other to become better inspectors. Also, we will be launching a new software program called Fetch EH, and that's going to be across our foods and our environmental, so you're going to hear this a little bit as we move forward. But that will help eliminate duplicate entry, eliminate paper and inspection reports. Part of what I mentioned digitizing, we had file cabinet after file cabinet, and we were able to digitize all of those old paper inspections and really streamline our processes. And then reporting to assist with enforcement and training needs throughout the county. Okay, so that is the end for the foods. And now I'm going to invite our environmental director, Ray Nieves, up to talk about the environmental division. Okay. And also, Sally, you're going to have, or Sally, I'm going to let you say your last name. I don't want to mess it up.
Hello, I'm not as anybody in this. I'm Director of Vector Control and also Environmental Health.
Okay, so if one of you just wants to hit enter as you go, and you might need the microphone, you can hold it.
Good morning, everyone.
Good morning.
We have made many strides in the last couple of years, especially last year. Dr. Sheila, Michelle, they have really pushed us to make sure that we get our KPIs accomplished with the state, with Health First Indiana. So I just want to share a few photos. That's us on the left there at our first Lake County Health Fair, which was at Hanover Central High School. It was very successful. We had quite a bit of people. And then there is, I'll try to get a little closer. The second photo is Tracy collecting pool samples. Here are some of the things we do in the office as well as the field. And that's me working with my cohort, one of my inspectors in the office regarding a SOLS report. We evaluate those for septic systems. On the right is one of our summer help personnel at a Boys and Girls Club. So some of our wins are environmental combining forces. We've combined with foods as well as Vector to become a stronger team, and that we have definitely been. Participating in our first health fair, providing the public with valuable information, completely scanning and transitioning to a paperless system, which has been amazing for us. Participated in more outreach programs for pools, Vector, and environmental. Sarah, who is not here today, she has successfully transitioned pool water testing from microvac laboratories to IDOH labs to save our department quite a bit of money. We've adjusted permit fees to help offset costs for the department. We've saved the department money by not replacing our whiting inspector and cutting down on summer staff in pools, making it work by delegating the workload to current staff. We also took Alex from our summer team and have hired him to help with our public flow through the office to make sure that folks are showing identification, logging into our building, so we don't have people roaming around that are lost or not supposed to be in the right place.
And that's just another picture. We were actually at the Lake County Lake County Lake County Fair. I wanted to say health fair, but it's just the Lake County Fair. We were invited this year, so it's pretty exciting for us. Just some more pictures we have. Again, that's at our first health fair, which we believe was a really good success. Some in-office working, again, pools, they're sampling, and in the, the right bottom corner, it's when we were at the Boys and Girls Club, we did a Vector outreach program to just teach 200 kids about the safety and the things about Vector. Okay, so here are future goals where you hope to cross-train in pools, Vector, and environmental to help the team with workflow. We continue to expand our outreach program for environmental pool safety, Vector, septic upkeep, asthma, mold, certain topics in environmental. We'll continue to move forward to be fully digital by 2026, learning Fetch so that all team members are proficient in Fetch. Continue virtual training with IDOH, keeping up with advances technology in pools, Vector, and environmental topics. We're going to work on body piercing and tattoo, eyelash extension, county ordinances, possibly implement a fine ordinance for environmental violations. And Sarah would like to expand her knowledge on the pool plan review as we continue to provide support to pool operators who are consistently going through different changes. And I think that's it.
Thank you.
Excuse me, Ford, can we just pause real quick with this because Anishi has something she needs to share because she needs to leave a little early.
Sorry. Okay. Hopefully everyone can hear me okay. I want to first start by saying this is about the contracts and some changes we made to the contracts, but there's no, I just want to make clear that we didn't have any issues with this in the past contracts, but this is something that we're implementing in the new contract. So you were given emails of all the new contracts before the meeting today, and I just want to point out 3 sections that are new. So section 4.3.1, this is an audit requirement. You guys don't, I don't think have the contracts with you. If you have them in here,
It's not.
it's not printed out, but they're in your emails. And I'll go over them with you again 100 times if you need. But section 4.3.1, as we are having renewals for these, some of these programs that were funded last year, we wanted to do a kind of an audit to make sure that everyone is performing the way that they wanted to perform. Because if there is any type of performance that they don't believe can be scaled up or it's gonna be scaled up or scaled down, we need to know that sooner than later. So if, for example, they had a $100 contract and they're renewing it for $100, we want to make sure that $100 was spent the way that they anticipated it to be spent, so that going forward it would be spent the same way. Which brings me to section 5.2, which is a scalability clause, and there's subsections in there as well. Again, we did not run into this problem because with the renewed contracts, and I talked about this last time, if they had any money left over, it was either going to be returned back to HFI or reallocated to the new contracts, and then depending on where they didn't use the money before, if they were reallocating it or if they had other areas where they were going to use that money. But this specific clause now has said that as we are auditing them monthly, if there is an issue with actual performance and the payments that they're receiving don't align with what they had proposed, that we can scale the program down. If they want to scale the program up, they have to redo the contract and it has to come back in front of the board if they want more money. But if they are not performing as they should be, and we know that sooner than later, we can scale the contract down without it having to come in front of the board. However, if they are unable to reallocate that money in real time, then we will pause funding, and that brings me to section 3.4.1, which is a new section, where if they are unable to tell us how they are going to reallocate the money they haven't spent sooner than later instead of waiting till the end of the contract, we can pause their next payment to scale it down. And that pause will not constitute a breach of contract. That was the concern in these contracts, is we waited till the end, because if we weren't paying them the way the contract was designed, then we could be in breach. So now we've added that clause that says if there's a delay in the payment moving forward because they're not meeting up to the performance they promised, then it's not going to be considered a breach of contract.
Thank you,
Any
Anishi.
questions? Okay, thanks, everybody. You still have an attorney here, by the way. I'm leaving you in good hands.
You won't leave us naked.
No, never.
And then I think I'll go ahead and do a roll call for those here since we had somebody added in that just came in. So I'll go ahead and call off your names and please say if you're here. Philip Golden.
Here.
Dr. Hess. Here. Dorian Patel. Here. Dean Button.
Here.
Dr. Ninjakubi.
Here.
Leona Chandler Felton.
Here.
Dr. McCullough. Here. Dr. Forright. Wasn't sure if he had joined us on Teams. And Marla Hoyer LaRue. Absent. Okay, good, thank you. And then that'll be the very end. Was number 2 week? Okay. Oh, sorry. Dr. Bobby Lala.
Here.
So sorry, I didn't have that on.
We're still trying to streamline the process.
Okay, Michelle, you ready?
So our shared services department, you'll hear more commonly, you'll hear of like our nursing, our immunization clinic, environment and foods, but I just want to give you a little insight as to what we refer to as shared services. So shared services may be like our vital records where you come and you get your birth and death certificates, maybe paternity affidavits. It consists of our communications team, our Health First Indiana programs, and our education department and our interns, also emergency preparedness. So just a little bit into our department here with vital records and billing. Some of the wins that we've had over the last year or two would be digitizing our records, as we've mentioned. This is huge for our department. We've also initiated the credit card payments and partnered with a third party, VitalCheck. This is going to be rolled out for credit card services across the entire department, but you can access your vital records online and pay credit card in person as well, which we were formerly just cash or check. We've also had our medical billing and credentialing. Again, sorry, part of our shared services is also our billing department. So we are now accredited and able to bill for services for insurance and third-party payers. We have saved our department by partnering with Amazon as one of our vendors. So we're able to purchase maybe like office supplies or different things at a much lower rate to save the department money. So that's a huge win to have that partnership with Amazon. As Sheila had mentioned, one of our grants that we were awarded was our Autism Elopement Kits initiative through the Trauma and Injury Prevention Grant. Two of our vital records staff is kind of spearheading that initiative. And some of our goals for the upcoming year is to, in vital records, we have, a full database of all of our births and deaths. So we want to really leverage that data and look at where our new babies are coming and send them a welcome new baby to Lake County with all kinds of supportive resources and how to access certain needs that you may need, and the recommended vaccination schedule. We really want to strengthen our partnerships with our hospitals and our funeral homes. And as I mentioned, with the medical billing, we want to expand and we can go for lead services too. We've also created our volunteer program. So that is where we have volunteers that kind of help greet our residents when they come in and just kind of get them through the department and all of that. Our communications and IT, we have been working to establish a ticketing system to monitor and escalate IT requests. We have launched our 2026 Community Needs Assessment via multiple communication channels. So this is really big. You've probably heard us talking about our Community Needs Assessment. We are getting ready to roll it out to the community. And so if you hear about this or you see the link, please take a survey. We really want to hear your voices. We want you to share this so we can get all of the residents from Lake County to let us know what they need in their community. So this is huge for us, and it's really going to drive our initiatives moving forward. Some of our goals in communications and IT is improving our internal and external communications through social media and website messaging. So we are really amping up our social media. We want to share all of the work that we're doing together. For us as a department, for you all in the community, we really want our residents to know what services and programs are being offered, and we're really trying to work very, very hard at raising the awareness of that. So it takes all of us to share that. So that's our initiative for this year. And then as well as collaborating with partners to educate county members of services provided. So, with our Health First Indiana, we've begun a newsletter. We really want to bring partners to partners and get that awareness going in the community. For emergency preparedness, we have increased the awareness of our emergency preparedness in our department and kind of what the expectations are of our staff in the case of an emergency. And one of our goals is to get that into the community as well. What you can expect in the case of an emergency, how can we best be prepared as a community and what our roles are. We've also been focusing on our timely deliverables and strengthening our community partnerships is really where we want to go this year with our emergency preparedness. So in order to get everybody on board and understanding their role in the community, we want to obviously connect people together. Our education, over the last couple of years, we did just have one public health educator. We've expanded and established an entire education department. So we have our public health educator, and we have 3 school liaisons who work very closely with the schools, as well as our internship program that falls into that as well. So we have increased our presence in the schools. We have launched a school needs assessment. When the school liaisons came on last year, they put out the school needs assessment. That we have built the program and offered the different services and programs to the schools based on what the schools were requesting of us. And we have also fine-tuned for this year to send out a new, to include some school gardens and some food insecurity resources so that we can identify that. This would be very helpful as we have the food bank locker being installed at the health department. We now have the ability to identify those that may be at risk for food insecurity and be able to directly connect them with resources. We've expanded our education programs to include substance use prevention, mental health, dental health, nutrition and physical activity, for example. So some of our goals this year in education is to develop a internal nutrition and physical activity program and establish our mental health programs, which could include self-esteem and anti-bullying. As you may have heard, we've had some, unfortunate losses due to bullying in our community over the recent months. So we really want to establish and get going on some initiatives like that in the school. And then also you heard from Sheila about the opioid funds. We have been awarded part of our grant for the opioid settlement funds to implement our engaged youth substance use prevention. And this is going to focus on school interventions, life skills training, drug refusal skills, and really connecting with the families through family workshops, providing maybe safe disposal kits, and different things like that. So that's in our education. Our Health First Indiana. Again, one of our wins is our food bank lockers are en route. They're coming from Australia, so they'll be here soon. They've already poured the concrete. We've also granted and awarded new partners for 2026. We have seen, since the start of partnering with you all, we have seen partners working together, systems working together and connecting. We had just a brief, I'm going to keep it short, but just a brief little, we had a resident call our vital records department, and they just were asking about needing access to food. Lo and behold, it was a much larger story, but we connected to Denise, who had Faith CDC in their office, who provides weekly meals. And so then we connected to Mobile Integrated Health. So the patient I call patients from the hospital, but the resident who called looking for food insecurity, they actually were struggling with dementia. They didn't have any food in their home. They were in, the husband was in the hospital, and they now have food delivered and connected with Faith CDC. They were connected with the food bank, and our Mobile Integrated Health is working on that continuum of care. We also worked with another of our partners to get them access to insurance. So this is all of you all working together, and it's really working out exactly how we envision it too. That's really for the sustainability of the county, with or without funding, is really you guys all making aware of what's out there and working together. Again, I mentioned the community needs assessment is in process, and we started the HFI Partners newsletter. Denise has sent those out, and so We'll be sending those out every month to highlight some of the services and programs you guys are offering, any events, and any new updates. So for example, from today's contract updates, something like that would be in there. So we really want to increase that communication. Our goals for that is our on-site visits with partners. Our Health First Indiana project manager will be going out and working with you all in the community and just seeing how things are going. We're really prioritizing new partnerships in 2027 in alignment with the community needs assessment that we're putting out. So we're going to focus on the top 3 to 4 community needs from that and really showcasing partners on our website, social media, and providing opportunities for partners to meet and collaborate with one another and really increase our awareness of how we can combine programs for one common goal. Thank you.
All right, now we're going to hear from our nursing director, Mary Ann Kundich.
Good morning, everyone.
Good morning.
The nursing division at the health department had a whirlwind of 2025. We started with the launch of, can everybody hear me? I don't know. We started with the launch of the mobile clinic in February. Since then, we've had the mobile clinic out most weeks, 3 to 5 times. We are reaching areas that people are not able to come to us, so we are reaching the community with transportation and access. We expanded our outreach efforts to educate, provide resources to residents in areas with health and access challenges. We've expanded preventative health services, including blood pressure checks, glucometer checks, heights and weights for people that want to know about their general health. This is mainly done on outreach when we're out in the communities. We've increased our immunization hours to include evenings and Saturdays, which will hopefully bring our immunization rates up. Our lead program has really taken a good part of 2025. We are now offering lead testing every day in the office, and when we go on outreach, we also offer out. The lead program is to educate. This is a program that it is from 9 months through 6 years of age. So we try to get the children when they're young to make sure they're eating the right type of food, nutrition. We have a case manager that goes out, talks to the family, she checks the resident. She's able to do risk assessment, which has saved the health department money because we were paying for the risk assessments of the home. So she is able to do that now on her own. And of course, she works with the families. Most of these people are renters. She works with the families and the landlords trying to get remediation started. Our TB testing has also increased. We are now doing blood work, QFTs, which is a blood test for TB. Last year in 2025, we were managing latent TBs. We're able to treat the patient without any cost. We get the vaccine or the medication from the state, from Purdue University actually, and they're treated with no cost to them at all. In 2026, we are now taking on active TB cases. So far, we have not had any in January or so far in February, but we will be doing active TB cases. We also have strengthened collaboration with the Indiana State Department laboratory to improve specimen transportation and make sure our specimens get to them properly and in a timely manner. In October, this was a big, huge step for us. We now are offering STI testing. We do all the tests that the state allows us to do. There is a couple that we are not doing for whatever reason. The state feels that they need to go to a physician, but we are able to do all rapid testing, and then if a blood draw is necessary, we proceed with that, send that specimen to the state. We also can treat anybody with an STI in our office right at the time that they are there. We have the medication that we get free through the state. In 2026, we plan to increase our, we want to engage more with each individual patient as they come in. We want to assess them. Right now, basically, we have been doing immunizations and epidemiology, but we want to be able to spend more time with the immunizations instead of just giving them what they want and, you know, following the schedule, sending them off. We want to get a better outlook on what's going on with them. Possibly we can send them to resources that they need. We are going to work along with shared services on new moms in the hospital. We're developing a pack also that we would like to send them. We are going to start reaching out to different restaurants and businesses to see if we can get any type of coupons that we can offer the mothers when they're going home from the hospital. Maybe a free meal and or free meal or, you know, diaper coupons, things of that nature. So that's what we're working on now for the new moms that are leaving the hospital. We also are expanding our TB response. I said by taking on the active TB cases, plus we are developing a structure since we haven't done this in the past. We have to make sure the patient has adequate housing. If there are young children in the house, the patient is not allowed to stay in the home. So we are developing a program where we will be able to take care of all of their needs. We increased our STI testing already. We started out slowly. We were by appointment only. We are now walk-in. We are there Monday through Friday, 9 to 4, so there is a lot of time. We will also be doing STI testing when we are out in the field. We give all vaccines from birth to adults. Some people have insurance that covers vaccine. Otherwise, we are able to accommodate you one way or another. And then one thing I don't have up there that I thought of is we are opening a hygiene pantry in our office, actually, right next to the nursing department. That will soon be up and running, and it's going to be for all ages.
All right, thank you very much. Just say these guys did an excellent job. They are not used to presenting like this, so excellent job, everyone. I don't think we have anything else.
Okay. All right. The next item on the agenda is the minutes from the previous meeting that was held in November 5th, 2025. Does anybody have any comments, or do we entertain a motion for approval of the minutes?
I make a motion we approve the minutes from November 5th, 2025.
Any second to the motion? Yeah.
That's second.
Second. All in favor?
Aye.
Aye. The ayes have it. The next item on the agenda is the old business. We were talking about a proposed salary adjustment.
Yeah. So, okay, if I go ahead and take that?
Yeah, please.
So last time when we talked about some of the salary adjustments, the board members had some questions and they wanted some more information before proceeding. So I think I have been able to either meet with you or we'll go over some of those things right now. One was budget data and sustainability was discussed. And I think it's important to note that we in the last year have been looking at our vendors and ways to save money. So for example, we have started using a different water lab that saves us $30 per water sample, which will save us over $80,000 annually. Also, with the adjusted fees that have been approved, we anticipate bringing in more than $500,000 in additional funding into the health department. I think it's important to note also that our health department funds are non-reverting, and that means that they stay with the health department. They do not go back to the county. And then you have in your packets there our 2025 profit and loss statement. So that's this one, and that will show you kind of where we are with each fund. We are utilizing 2 funds to cover these salaries. One is the health fund, and that's for 2 of the positions, the deputy administrator and 1 of the medical assistants. And then the other 3 positions, another medical assistant, the admin assistant, and the biller, are all paid out of Health First Indiana. Make sure I didn't skip anything here on our notes. Through talking with board members, we did lower the deputy administrator salary we were proposing to meet kind of what some of you folks were thinking was more in line. And then if you take a look at the comparisons that are provided there, you can see that we are pretty much middle of the road for most of the positions that were comparables in other local health departments. With the exception of the one, we'd still be the lowest salary when comparing that one. With each of these positions, we have changed the scope of work beyond what we originally thought we would be doing, and that's why the request is there. So the deputy administrator, the previous role was more of office manager position and more clerical, and we have changed that role to really focus on strategy and helping to inform our future for the health department and making health impacts across the county. And that includes education and management of a much larger staff. Before, the deputy administrator managed about 6 people, and now they will be managing 14. And that role now requires a bachelor's degree with a master's preferred, where it did not require that before. Administrative assistant, that role previously was just mostly handling invoicing and running some permits. And now we have added to that working with all of these contracts for our HFI funding, which is a huge undertaking, and ensuring that our partners are being paid and followed up with. And they are also now doing payroll and onboarding, which is anybody who's done payroll at their business. That's a big undertaking as well. Our medical assistants, we have 2. One was hired to focus on lead and case management, as you've heard a lot about today, and the great work that she's been doing there. But because we have expanded what we're doing in the health department, we are now asking her to take on STI testing and phlebotomy as well. Our immunizations medical assistant was hired to just administer vaccines, and with our expansion, we have asked her to take on epidemiology, STI testing, and phlebotomy. And then the last position, our biller, was hired for insurance billing, and we have now asked that person to cross-train with the administrative assistant to work on budget analysis. And she has also secured all of our accreditation for our insurance billing, which is a big undertaking as well, and she did not come on expecting to do that, and her job is to now maintain that accreditation moving forward. So those are some of the things about the different salaries. Do you have any questions for me?
So just to clarify, you took down the number of people that you are actually asking for an adjustment of their salary, correct?
I want to make sure I understand your question correctly. We did, we had multiple positions that we also eliminated from the budget to help accommodate with some of these salary requests. And I think we eliminated about 9 positions in all.
Okay. And then the board approved, where it shows current salary, board approved, is this what we approved 2024 to go to 2025?
Correct.
Okay, so, and that's so that you guys know that was never implemented. So we voted the end of 2024 for that pay raise, and the commission,
The council.
the council did not approve it.
They did not implement it at that time. It was a timing situation. They asked us to come back, and that is what we are going to be doing soon with them. We'll be going back. So now is why we are looking at a few of those positions that we felt were not up to par with their scope of work.
And then the proposed is for the end of 2025, going into 2026, correct?
Correct. And then I think it's important to note that these positions, had they been approved at the time when you approved them, they would have gotten a 5% raise on top of that, because the county did a countywide 5% raise. And because of that, they did not get that 5% raise on top of what we did approve.
So this is a period for them to be attributed.
No, it would actually,
If the proposed
so at so for the first one, let's go line by line. The deputy administrator, they would have been, I didn't bring that document with me, but they would have been making, if they'd gotten the 5%, about, I think it was about $82,000 with the increase. So that would have been about a 4% increase then that you would be approving here. With the admin assistant, it would have been about a 6%. With the medical assistants and the billers, it's a 2%, above what they would have gotten had that been approved, and they would have gotten the raise across the board.
Now, one thing I do also want to say, looking at numbers, I asked the health department to give me like their budget that they had in 2023, 2024, 2025, and what they proposed for 2026. And I have to say, looking at the numbers, that for their 2025 budget in most of their departments, they actually spent less than what they had budgeted for. So I was really happy to see that. And even in some of their areas for 2026, they're actually asking for less than what they had proposed for 2025. So I think overall, because we know that money is an issue and that, you know, we have to look how we spend things, I was actually surprised when I looked, but very happy to see that then their actual spending for 2025 was less than their budget that they proposed. So I think they should be commended for at least coming in and trying to, you know, physically look like they're using the state lab down in Indianapolis, which is cheaper, but does offer to me more testing than using a more local lab. So they are trying to look for ways to decrease their spending, and also, you know, the positions, again, with salaries, you know, having like the ones of us are working like healthcare, you know, some of these positions are highly needed because I can't work if I don't have a good medical assistant who's reliable, who's there today, you know, knows what I need, is literally my right-hand person. So, but the last thing I want to say is just so that people know that we did approve a budget for the SARS of 2025. It was never implemented.
And if I can build off of that just for a second, I do want to also note, because I forgot to mention it, that we are not asking for any additional funding from the county to make this work. We are working within the budget that they have asked us to work within, and so no additional funding will be coming from the county. And then you are so right, Dr. Hess, our goal is to attract and retain qualified candidates. And these salaries will keep us in line with the comparable counties, but also the private industry. It's very hard for us to compete with the private industry.
Any other comments?
Yeah, I was a no before after speaking with you, and my big concern was sustainability. And if the FHI contracts were to go away, and they could very well go away depending on administration, what have you, I didn't want to be stuck with all those salaries up there and all those positions and all these programs that disappear, and then we're paying all this money to the staff. So I was liking the way it was maneuvered. So if you look at the bottom of the funding source, some of those positions that they're requesting the raises for are under the FHI funds, which is great. So if those funds go away, then obviously it's a huge problem because there's a lot of people, or there's be a couple people out of work. But I mean, we'll have to come back to the table and kind of figure out what this all looks like. But in the meantime, I'm for giving these raises for that reason, along with, if you look at the comparisons, and if you look at Fort Wayne and Elkhart and other counties, we're actually under what the proposed is. So I don't have a problem. I'm glad it was maneuvered, and it looks a lot better now than I think what it did when it was initially prepared. So I'm ready to make a motion that we approve the proposed salaries for those 4 positions.
Any second for the proposal? All in favor?
Aye.
Aye.
Can I do a roll call? Is that okay?
Yeah,
Do you mind
please.
if I go ahead and do that, just to make sure we have it all accounted for?
Sure.
Okay, so we already had Philip Golden and Dr. Hess, Dorian Patel, Dean Button,
Yes.
Dr. Ninjakubi,
Yes?
Leona Chandler Felton, Dr. McCullough.
Did you call Dr. Hess?
She's
Okay,
second.
you had the second, so I didn't include you.
Okay,
Do you want me to,
all right.
Dr. Hess?
Yes.
All right.
Can I just ask a follow-up question?
Yeah,
When
please.
do these salaries go into effect? When do they become effective?
Yeah, so we have submitted the paperwork with the council, and if they, because we don't get to make the final decision as a board, the council does make the final decision, so they could still not move forward with it. We did put in for, if they approve it, it will be effective January 1.
Wonderful.
Good question. Like Dr. Golden, Mr. Golden said, if the HFI fund went away, would the responsibility of this office be commensurate with the number of things that you don't have to do?
Well, let me answer that question. So a lot of the salary comparison, in all honesty, is pre-HFI. Even before HFI, in 2021, the Richard Fairbanks School of Public Health in Indianapolis has done a huge research project comparing all the county health departments across the state to see how the pay comparison is. And they have put out their information, which showed that the Lake County Health Department staff is being comparatively, for the same size, approximately, is being underpaid. So when we are talking about HFI, has that increased the amount of the work and all? Absolutely. However, these pay raises actually do not even reflect the additional work that comes with the additional HFI work. This is even the comparisons are previous to HFI work.
Mhm.
And if we are asking what is going to happen to the positions, what is going to happen to the funding when, if HFI funding goes away, which everyone in the health department or across the Indiana state are hoping it won't. However, if it does go away, then we have to come back to the table. We have to revisit the numbers. And we at the health department will do our best to work within the budget without compromising the resources. So that's where we are.
All right. I see another question that may be related, but not directly. You had said that when people came for services, the fees they are charged is based on their income. How do you graduate those fees? Because they are really one of the sources of income for the health department.
So our fees are standard for food inspections, environmental, and vital records. However, our nursing department, we do have a set fee, but if they say that they are unable to pay for that, nobody leaves our building without getting the service. So whether they are able to make a donation of whatever they feel comfortable with, then we will allow for that. It's really what they feel comfortable with and they can afford, but our mission is that nobody leaves without the service.
Excellent. Thank you. All right. Moving on. We are in old business. In new business. HFI contract updates. I think we have renewals that we can group, especially if there are no major changes to the contracts and their services. If we can renew them, we'll be able to do a whole bunch in a short time.
Would you allow Denise to just run through them very quickly so
Please.
that they can know kind of where everybody stands?
Sounds good.
Okay.
That's very helpful.
We are at 8:30, Denise, so I don't want to rush you, but if we pick up quickly.
We're warming up here.
Give us a minute to warm up, Anna. Okay, they've got it in front of them.
Okay,
You can
great.
go ahead,
Okay.
David, and you can see it. There you
Okay, yep, okay, so the 26 grant renewals, just to go over this real quickly, it is gonna be a 9-month grant cycle instead of a 1-year term. So they will run from, our programs that are here now, their program will end this March. So they are renewing from March to December 31st of 2026, so that all grants will be completed by the end of 2026. The goal is that we will have no more quarterly grants, and also bridging our HFI partners together to share resources, events, and collaborate with one another. We discussed the new revisions to the contracts, and we went over those. Moving forward into the future of 2027, grants will be one-year grants only beginning in 2027. 2027 grant applications are available until June 30th of 2026. Grants will be more competitive in 2027 as available funding decreases. Appropriations of grant funds will be determined by the Lake County Health Department needs assessment and state requirements, and selected grants will be presented to the Board of Health in November for the approval for 2027. So moving on to our grants. We have Faith CDC, Food is Medicine. In 2025, they were granted $200,000. They have no rollover funds from that grant, and for 2026, their renewal request is $150,000. We've heard about Faith CDC earlier. They deliver medically and culturally tailored meals to individuals with chronic conditions in partnership with local urban farmers, healthcare systems, and physicians. They have had great outcomes with participants, less medication, reduction in medication, and hospital visits. This is their metrics. As you can see, in May, they have 30 participants. 25 of them were identified as having blood pressure above 130/80. As the program went on, their blood pressure has decreased. So the program is working. You do see a little uptick in October because they started a new program. So they have met 3 out of 8 of their monthly goals were met, and 5 out of 8 have exceeded. Aliveness Project, Bridging Hope, Infectious Disease. In 2025, they were awarded $200,000. They have 0 rollover funds, and for 2026, they are asking for a renewal request of $150,000. Aliveness Project aims to detect and prevent the spread of infectious disease, such as HIV and Hep C and sexually transmitted diseases. They've engaged a lot more with the community in getting them in for HIV and Hep C screenings, and taking those people that are at higher risk for infection and linking them to providers of care. They have met 3 out of 3 of their annual goals and actually have exceeded with their HIV screening and Hep C screening.
Just one second. We have, just for some information, we have simplified in the form of slide presentation with a single page for every contract. So, and if we don't have time to look at the entire thing, the simplest way to look at it all the way to the right, where it says what was their goal, what exactly did they say that they would be able to achieve. And in terms of aliveness program, it appears that the HIV screening, their goal was to perform somewhere in between 75 to 100, and they were able to do about 388 on the right side. So that basically shows that they have exceeded the expectations of the program, which is good. So this one-page slide going forward is going to help the board members just to look at one page where they can see the performance per each month, and then as well as the total performance. And if someone is, our goal going forward is if someone is unable to achieve a year, we will be sharing all this information with all of our partners. And if for some reason they are unable to achieve their program goals, we are going to ask them the reason, as well as we will do our best to support them succeed, because we want everyone to succeed. However, at the end of the program, if we feel that they are not on the same page with everything, then we would have to revisit their contract and make the decisions at that point.
Okay, then we have Shine, Love of Arts, Youth and Family. 2025, the grant reward was $18,500. They have 0 rollover funds, and their grant renewal request is $15,632. This program aims to support recovery with a focus on mental health and substance abuse with group sessions, evidence-based curriculum, and family unification efforts. As you can see, the impact, the youth really enjoy coming to the events. They learn new things. The picture down here, they're at a church, and the parents and the students were together and were praying over each other, and I just thought that was something nice to share. Shine Love of Art. Oh, that was Youth and Family. This is their metrics. So they have 4 out of 6 annual goals that have met or exceeded. 1 out of 6 annual goals are almost met, and 1 out of 6 annual goals are still in process of meeting. And we have Shine Love of Arts Cafe Transportation. In 2025, they were rewarded $37,500. 30,000 of that went towards the purchase of their van. They will have 0 rollover funds, and they are requesting $6,000 for 2026. They use the van to transport and assist with improved access to resources, ensuring members can fully engage in recovery and connect with critical care and support systems. Since they've had the van, they have had increased attendance in recovery support groups. And here are their metrics. As you can see, they have been giving many, many rides. So the transportation is working. Then we have Safe Coalition, A Better Way. They were granted $200,000 in 2025. They have 0 rollover funds. They are requesting for 2026 $154,300. This program is a one-on-one therapy session, parenting sessions to help mothers and children interact in a positive and respectful way and build respectful relationships. The program also trains professional personnel to identify victims of sexual abuse, assault, and/or human trafficking. Helping women and children receive mental health recovery for domestic abuse is a huge impact that this program has made. These are their metrics. 1 out of 1 of the monthly goals are almost met. 1 out of 4 annual goals have met or exceeded. 2 of 4 annual goals are almost met, and 1 of them are still in process of meeting. We have Sounds of Sarah, the Prevention Pathway Initiative. Last year, for 2025, they were rewarded $163,950. They had $4,000 in rollover fund that they allocated into their budget for 2026. Their request renewal is $129,240. This program reduces substance misuse, expands across to life-saving resources, and foster community engagement through evidence-based programs, outreach efforts, and partnerships with schools and local organizations. The impact, they have increased in naloxone boxes throughout the Lake County community, increased training for at-risk youth and professionals for overdose prevention. And just on a side note, Lake County has seen a decrease in fatality overdoses. So the naloxone, regardless who's distributing it, seems to be working. Sounds of Sarah, this is their metrics. They have met their goal, 1 of 1 monthly goals met and has exceeded, and 3 out of 3 other annual goals have met and exceeded. And that brings us to questions.
Are there other programs that were up for renewal that didn't make it to this meeting and we have to do the next meeting?
Yes. Yes. What we have, again, just to reiterate what the plan is, we are only renewing the programs that are coming up for renewal, that are going to be done by March. So we don't want them to run into no funding, so we are just renewing the ones which are coming up. The next one, we're going to bring them again back in June. However, once 2026 is done, starting next year, we are going to be on an annual schedule, just so that it's not going to be a quarterly one.
So the ones that we're going to do in June, that's just essentially for 6 months?
Yes.
Gotcha.
That is just for 6 months, everything. So
if they've run out of money before June, then they just have to wait till June?
they should not be. They shouldn't be.
Oh, because I got you.
The money has
It's not
already
a calendar
been
year, it's a,
exactly.
I got you.
So theirs was June to June. This is March to March. So
Okay.
no one should be running out of any money before they come up for renewal. And whether they're going to be renewed or not, obviously, would depend on the performance and also the need and the programs viability.
Gotcha.
And if I might ask,
Yes.
in the book, under grant period from March to December, is the $294,000 what remains to be allocated in June? So you reduced the awards by that much.
Yeah.
Do we know what the expected remainder is left in the program? Is that too complicated.
Reduction in rewards,
So that is the 1 year contracts came to that amount with the 9 month. It's less, obviously. So that is what we're stating is the
Oh,
200 and
less.
that is the savings that will get rolled over into the remaining budget.
Okay.
Yeah, so it's a savings.
Savings because we are
Because-
not doing for an
Because we
entire year.
reduced,
Yeah.
yeah, because
Because
it's only
we're
9 months.
9 months.
Yeah.
Okay, so it's not
Yeah.
necessarily savings. It's a shorter period.
Right.
So someone who has been awarded 200,000 for a period of 1
Yeah.
year, because they are being awarded only for 9 months, that's why they're coming and asking for 150. So it's not necessarily a savings or anything. It's just leftover funding, which we can use it to carry over for next year.
Right.
So this could be used for the June requests.
This can be used for the June request or maybe for next year.
For
Like,
27, yeah.
So yeah, whatever money we have left over.
But that may not be all of the money left over. It only relates directly to these
100%.
programs.
Yeah, we have more money left over.
Understood.
Yeah.
Thank you.
Two
Any other
questions.
comments? Yeah.
So on Safe Coalition, where they really did not, only met one out of their 4 goals. What's nice with the draft is, so do we go back to them and say like,
I think they probably might be here if you have any questions. Is anyone from Safe Coalition here? Yes.
so my question is, and also to commend you guys again, that I met with them last week to go over the grants that were up. And also, we always put data in, but we never take data out. So that's the problem with most companies. You can put everything in, but then you look at it, pull it out, look at it. So we really didn't have that. We all talked about, hey, can we do this somewhere in a grant? In graphs, can we really see, like, are they doing what they're supposed to be saying they're doing in their grant requests? And I cannot believe you guys did this in like less than a week. So I love this graphs. I love data. You can look at it now. It's very clear. So thank you so much for doing this. And then my thing is, because now we are able to look at it, we see that Safe Coalition, they did not meet 3 out of their 4 goals. So that's something we have to look at to see if they're going to renew in a year or whatever, like that, hey, what's going on? You're not meeting your goals what you're requesting.
But their
But
program
they're
isn't
here,
over
right?
yet.
They're here.
Right,
Maybe
yeah.
we have to give them a
Yeah.
chance.
Yeah.
Still here. So one of our goals is to have 40 trainings, right, over the year. We still have 6 trainings left.
Dr. Gopal, could you please speak up? We cannot hear.
Medical trainings, we still have about 4 or 5 trainings left. So we're not fully done. March is our end goal.
Okay.
We're still doing a peer review. We're still doing a substance abuse treatment. We've actually, in some ways, exceeded some of our goals, maybe an incorrectly, but we've actually done so many more parents that not given them. The new parents we've actually now did a video of our medical training so that we can now give them to the hospitals and then have those given to the physicians. So one of the challenges we had when we first started is scheduling those hospital trainings because it's very difficult to get a bunch of physicians together in the same room. And so what we did is we were able to schedule all the offices except I think the only hospital we didn't do is so that's what we schedule. We do that next time. So we are now, and hospitals also have to have their general body meetings, and when they have those, that's when they get us to come train. They give us an hour and they get to train. So that's why those records.
So, Dr. Gopal, what you are saying is that you have a lot of programs in place.
We do.
That's going to take a little more time for us to see the results.
Correct.
And then
we have full
By March.
yes, by March we should have more results. And then hopefully by the end of, if we are going to renew this contract today, then this is going to extend until the end of 2026. So hopefully we will be able to revisit some of the questions, of course, throughout the year, but maybe 2026 to see what's going to happen in 27 and how we can continue to make it work.
Absolutely. Since the program for registering was new, it's already now in place, so now it's really easy to just continue.
Okay. Any other questions? All right. we'll move on to the next item on the agenda, which is
I think they need to be voted.
oh, they need to be voted. Okay, all right.
So we'll need a
Can we
motion and a
entertain a
second.
motion for accepting the contract as they are presented? Any seconds? All in favor?
Aye.
The ayes have it.
I'm so sorry, can we do roll call just to make sure on it?
Sure,
Just-
okay. All right.
So real quick, we'll go through and I'll say the ones who made the motions, just so we're clear. Philip Golden,
Yes.
Dr. Hess,
Yes.
Dorian Patel, Dean Button,
Yes.
Dr. Ninjakubi,
Yes.
Leona Chandler Felton, Dr. McCullough. Okay. All in favor. Thank you.
All right. Well, we are in the next item on the agenda, which is election of board president and vice president who present session of nominees and voting of nominees. Now, how is that done? Huh? No, okay. All right.
Unless someone wants to nominate themselves, I guess. And then someone is going to second.
I nominate Mr. Golden here for president.
Respectfully decline.
Yeah, okay. All right.
Is there a second?
Second.
All those in favor, say aye.
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 Any opposed? I feel comfortable not doing roll call.
Okay.
Congratulations.
Oh, thank you. Thank you. All right.
Vice Chair?
The vice chair? Huh? Mr. Golden? Sure. All right.
Second.
I would like to nominate myself for vice chair.
Let's take a
Any
vote.
second? For vice chair. Mr. Golden?
I seconded Mr. Golan.
Golden, okay.
Yeah, I
uh-huh.
did. But
All in favor of,
But
and
she
then
was
chair,
second.
chair. Oh, you okay, nominate yourself,
I'm
okay.
nominating myself.
Any
for
second?
Vice chair.
Mr.
Second.
Cantor, can you please let us know how?
How is that?
Okay, so the first thing that we're gonna do is vote on Mr. Golden. He
Okay.
was nominated first and see if that vote passes.
Okay, all right. We have a nomination from me and second, all in favor? Aye?
aye.
You wanna take a roll call?
I can.
Mhm.
All right. I don't do Philip, right? Dr. Hess,
No.
Dorian Patel,
No.
Dean Button,
I seconded, so I, yes.
okay, Dr. Ninjakubi,
Yes?
Leona Chandler Felton, and Dr. McCullough. Ooh, okay. So then now we do Dr. Hess.
Okay.
Okay, so now we're gonna do Dr. Hess, and I'll start from the beginning. Philip Golden,
Sure.
Dorian Patel, yes. Do I do Dean again? Dean Button,
Yes.
Dr. Ninjakubi,
Yes?
Leona,
Aye.
Dr. McCullough,
Okay.
Dr. Hess is our vice chair.
All right. Okay,
Congratulations.
congratulations. All right. The next item on the agenda is staff updates.
Oh, we already did that.
We did that.
I don't think we
That's
have
what
any other
we moved it
updates.
That's okay, moved it up, okay. And then a comment from the board. I have a little observation that I saw on the vital records that's kind of concerning on for the sake of public health, which is that we're looking here at the number of births last year. We have 17,157. And then the number of death certificates was 25,333. It looked like we're not having enough babies. And that's not good for the future.
The reason is that's the number of certificates issued. So lots of times when you get a death certificate, you might get up to 10 death certificates at one time for one person. So that's why the number of death certificates, it's just the certificates issued, not the actual number of births versus
Oh, I feel
deaths.
better already. All right. Any other comment from the board?
I have a comment.
Yes, please.
With the wide array of lab services that the Lake County Health Department provides, are we in competition with the hospital networks, the drugstores, the other urgent care clinics? Is there any will to take some of that business to provide revenue? I mean, is it a good source of revenue for the Lake County Health Department? I mean,
That's a good question.
Which particular service are we talking
the
about?
lab services, like all the testing that is done. I mean, are you seeking more business, so to speak, for revenue for the?
We actually were talking about, I was talking to Sheila just the other day. I don't think I want to necessarily look for additional revenue through lab services at this point of time, because that comes with a lot of responsibility as well, because it's not just ordering the labs, we have to make sure that the labs are followed. And it would be easier if the people who are coming for the labs already has a physician who is going to oversee them. The trouble will be if we are going to have labs which are abnormal and people do not have a physician, we can use that opportunity to connect them to the physician. However, it needs to be done in a timely manner. We are not against expanding the program, but probably not at this point of time because of a number of other things that are going on. So maybe sometime down the line.
Okay. One other question,
Yeah.
people can hear me. Is there a long turnaround time for the lab results? Is there a courier? Do they go to Indianapolis for the lab results, or is there a local lab who can
As of
provide
right,
results within an hour or two?
we are, the main results are like the STI, on the spot testing, right? And we know the results right away, like if it is. For confirmation is something that we draw a blood draw and then we send it out. And those labs, as of right now, are going to Indianapolis.
Correct.
And then the turnaround time is
In
typically,
general, you have the result within 48 hours.
Oh, that's interesting. That's
Yeah.
good.
Thank you.
and if at some point we are going to face any challenges, we will definitely revisit to see if we can partner with any of the local programs. But again, we are also making sure that all these programs are going to be cost effective without affecting the services. If it's 48-hour turnaround, we think that's reasonable. If we are going to face hurdles, obviously we don't want people to worry about their STI results and all, because we can definitely respect how stress inducing that can be. If those challenges come, maybe we might consider partnering with one of the local laboratories for once in a while urgent needs kind of thing. But we have not faced that yet. I've spoken to the Alverno lab head of the department in the past, and they said they'll be happy to collaborate with us. And again, the price needs to be competitive for us to do that.
I have a question. I have
Any
a
other, yes, please.
Not, according to what you just asked,
Yeah,
this is certificates that were issued,
yeah.
but what's the number of deaths?
The real number of deaths.
Right, the real number of deaths.
Well, yes.
The real number of deaths, if you would like, we can always put that number together because we have that information available. We do not have it here. Here, the main reason to show the number of certificates that are being issued is basically to show us the revenue that we are generating in terms of the vital record certificate that are being issued. As far as the number of actual deaths and births and all, we would be able to do this.
Okay, I think that should be on there.
The real deaths.
Sure, we can add that.
You could put on the number of certificates. You could put on the deaths.
Sure, yeah, absolutely.
Okay, if we extrapolate that, the number of births certificate is not the number of births for real.
Correct.
Okay, got it. All right. Okay. So any other comment from the board or questions? Now we'll move to the comment from the public. Does anybody have any comments or questions to ask the board? Yes. We are limited to 3 minutes. Yes, please.
Hi,
Per
my name is
person.
Maria Carrasquillo. I'm the Executive Director of Love of the Arts and Shine Recovery. And I just wanted to thank you all for approving our contract again and really share that your support has made a huge impact on our programming and on our county through the band that we were able to get, as well as our youth program. So I will look forward to another great year of serving you all in this county. Thank you.
Yeah, thank you very much. Any other comments or questions from the floor? If there are no comments, can we entertain a motion for adjournment?
So moved.
All in favor?
Aye.
All opposed? The motion carries. Thank you all for being here.
We just need to share the next board meeting dates.
Oh, okay, so we have the next board meeting date for June 3rd, and the next after that is September, then November. So we have 3 more meetings for the year. So you're all welcome to join us.
You did, okay, couldn't tell them as you were
Okay,
Bill.
sorry.
Okay, thank you, that's okay.
We should sit next to each other.
All right.
Yeah, the man always-
Can't complain.
That's it.